Nobody's here yet, but I said I'm going to do a live today. So here I am. And I was thinking that we can have a talk about something. So I was thinking, I get lots of questions on... okay, so people are joining in. So hi everybody, welcome. I was thinking that... so since I said that I'm going to do a live video today, I didn't really have a topic in mind. So if there's some questions that are coming in that I feel like I can address on live, and that's not a personal medical query, I'll just address it now. But aside from that, I'm gonna be giving some random tips. And I was thinking, hi, so many of my childhood friends jumping in. Hi everyone. For all the people who are sending requests to join the live video, unless it's like a medical person, I'm not like approving that, because we're going to be talking about something slightly medical today. My niece is also here, who's saying hello from my bedroom, because she's sitting in my bedroom right now. PCOS, PCOD and hormonal imbalance. Okay, PCOS is a very extensive topic. I feel like I'll have to address it in another video itself, and I don't think it's... Thank you. And I don't feel... Oh, my dog also is here to say hi. Hi, Coco. Hi. Okay, so PCOD diet. Sorry, I don't put out anything about diets. I'm gonna ask my friend Sangamitra, who's a nutritionist. She's my favorite nutritionist on Instagram. I'm gonna ask her if she can do a video and collaborate. Hi Siddhant. There's Coco. Coffee is sitting under my desk. I can show you guys coffee. Hi Coco. Coco, everyone say hi. Coco, chicken. So you say chicken and he will respond chicken. Oh. Okay. So yeah. So as far as PCOS goes, PCOS is a lifelong condition. Somebody's asking, can PCOS be cured? So PCOS is basically a lifelong condition. It's like having hypertension or diabetes. So it's a manageable condition, but you will never not have PCOS if you've been diagnosed with PCOS. So the thing is that just the same way as you take medication for diabetes, as you take medication for hypertension, if some of you have family members who do that, then you will know that they can take some lifestyle measures that can... Coco, can you move off, please, baby? Sorry. Yes. So you can take some lifestyle measures that can help you control the condition, but it's not something that can be cured. So you can manage PCOS, you can't control it. Aside from this, there was another question about... Coco, tum samne se hat jao yaar. Aside from this, there was another question about electrolysis versus laser hair removal. So this is once again your personal choice. Laser hair removal is good. It's quite expensive though. So is electrolysis. Why can one have very less period flow? Again, this is a very specific question. This depends on your hormones and stuff, so I won't be able to answer that without a consultation. Yes. So, increasing breast size, I already have a post on it. Go have a look. Going back to electrolysis versus laser. Electrolysis is basically where what they do is they take every individual hair follicle. For example, I have hair follicles over here. If I take one of these hair follicles and I electrocute it... Coco, please. Coco, hato. If I electrocute that single hair follicle, then the electricity is going to kill all the hair producing stuff that is in the follicle. So it can be used for getting rid of hair, and it's fairly effective for getting rid of hair permanently. A lot of trans people who are trying to get rid of hair on their face... Coco, mere life se hato yaar. Okay, sorry. So, yeah. So if you have a choice between electrolysis, or if you have a choice between... electrolysis and laser, this is completely your choice which one you choose to go for. It also depends on how much you can afford. Laser is a bit expensive, and laser also has this issue where the hair does come back. So I got laser on my upper lip when I was in school. I can't remember, it's been ages. Please show your doggy. Hello doggy, say hello. Okay. So yeah. Okay, questions are coming in really fast, so let me go slowly through them. Is PCOS and PCOD the same? I don't like to use the word PCOD because it suggests a disease. This is not a disease, this is a condition, this is a lifestyle condition. Coco really wants to say hi to everyone, so here we go. Yeah, also the international way of saying things now is PCOS. We don't really say PCOD anymore. Can less period flow be associated with PCOS? Yes, some people with PCOS do have missed periods, do have very long cycles where they don't get a period for like 15 days. Sorry, they don't get a period for like 30-40 days at an end. Is there any way to decrease breast size? I have a post on this, so please have a look there. Menstrual cups for beginners. Guys, I have a half-an-hour long video on menstrual cups. Please go have a look. I've answered every damn question under the sun on there. So go have a look there. Seriously, like I had asked you guys questions and I got all the questions and I answered all of them. Like, it's an extensive video. It's possibly the most hard work I've ever put into a video. So have a look there. I have normal period, but I have a cysts. Again, very specific, but cysts usually do happen for a lot of people and there's nothing to worry about. Unless, of course, it's a special type of cyst. But this is very specific. I don't want to give like a very generalized query, that may not work. Tampons for beginners. Tampons, my doggy is called Coco and there's another one called Coffee who is here. Hi, Coffee. Yes, so both of them are here now. Tampons for beginners, they're completely fine to use. It may feel a little bit uncomfortable, especially, you know, it's cotton. So putting cotton inside the vagina can feel a little weird because they can be a bit drying. So I usually recommend tampons for people on their higher flow days. For example, usually a lot of people have very little flow on their last day of their period. So if you have very little flow and you've put like cotton bandage over there, it can be a little painful or icky. It can feel very dry. So if that's the case, avoid them. But you know, tampons are completely fine to use, nothing wrong with them. Just make sure you are removing them every 8 hours. Don't leave them in there for more than 8 hours, even if they're the super absorbent types, because they can lead to huge problems medically, something called toxic shock syndrome. I will talk about it in one of the upcoming videos. Let's see. Whoops. Let's see. About menstrual cups. Guys, menstrual cups has a video. Go have a look. Breast size increasing, decreasing, both have a video. Go have a look. PCOS cannot be cured. PCOS is a lifelong medical condition like diabetes and hypertension. You can never cure diabetes. You can control it the same way. You can never cure PCOS. You can control it. Does regular periods mean we are fertile? It is an indication of your fertility, but there are a lot of other factors at play. We need to check your hormones and stuff. It's not necessary that just because your periods are regular, you will be fertile. But yes, they are an indicator on of fertility. Thank you so much for whoever enjoyed. Sanjana, thank you so much. I'm glad you enjoyed the menstrual cup videos. कोरोना का वैक्सीन कब आएगा मानस? मानस तुम बताओ कोरोना का वैक्सीन कब आएगा? I'm so glad to hear, Nikki, you could... Sorry. I'm so glad to hear you could buy a menstrual cup after watching my video, Nikki. And I'm happy to hear it was helpful for you. Coco is very excited to see everyone. Coco, क्या कर रहे हो? Are you a frontline worker? How's my experience dealing with COVID? So I work in a fertility and gynecologically... Coco, please, yaar. I work in a fertility and gynecology related setting. So yes, we are at high exposure, we are at high risk, but I'm not dealing with COVID infected patients as of now. Of course, I may be unknowingly dealing with COVID infected patients, but I don't know. So what we do is whenever we're having anything surgical, minor, major procedure, we always ask them to get their COVID test done. My best friend Sarvari, she is a COVID doctor and she works at Loknayak Hospital in Delhi. So a lot of my close friends are frontline workers and it's a very scary time for us. Okay, thank you so much. Poco ni Coco. Does laser on face trigger thick hair growth in nearby region? No, nothing of that sort. Will weight reduction to a healthy BMI reverse PCOS? So, there's very good evidence that reduction in weight does help control your symptoms of PCOS. And also, the thing is that I don't want to get too technical about this, but yes, I love you too, Coco. I don't want to get extremely technical about this, but the thing is that the more fat you have, the more the PCOS causing hormones are likely to be there. So it is best to reduce the amount of body fat you carry to reduce your PCOS symptoms. Additionally, I know losing weight can be very hard. Believe me, I've tried. I think the best advice to give for people with PCOS is that Coco, please hurt jao yaar. Okay, better. The best advice I would like to give people with PCOS is that it's try not to gain more weight than you already have. I don't want to make weight a stigmatized issue. I know it's very difficult and it's also very hurtful when people comment on the weight, especially when medical professionals comment on the weight. But it does have a role to play with reducing your symptoms for PCOS. So the best thing to do is make sure you don't put on more weight for PCOS. It will help reduce your symptoms. Is it possible to feed a baby with inverted nipples? Yes, you can get something called a nipple puller, which pulls the nipples out, and that can make it easier to feed a baby. Will having sex in alternate days increase the chance of pregnancy? No, absolutely not. So I'm going to do a post on fertile days, and I'm going to explain when the days are fertile or not. See, your entire cycle, you're not fertile for the entirety of your cycle. So there's some days where you're more fertile, and having sex on those days obviously increases the chance of you getting pregnant. But nothing like, I get this question very often that, you know, aaj nahi kiya, kal kiya, to pregnancy ka chance zyada hai. Nothing like that at all. Hi Samriddhi, I love your profile. Sending positive vibes back. You motivated you. Oh, I'm so glad, Ashwini. I'm so glad you got a menstrual cup. Coco, you got a menstrual cup and you enjoyed it too. Good luck. Thank you so much, everyone. Toxic shock syndrome. Sure, let me do that. Thank you so much. PCOS and PCOD impact on your fertility. So there is another huge misconception. I feel like this is becoming a PCOS live. There is another huge misconception that having PCOS makes you infertile. That is not the case. You can have problems with your fertility if you have PCOS, but that's not necessary. It's, how do I put it as an example? Let me think. Oh yeah, if you have momos from the thela on the sadak, which is using nali ka pani, you can have diarrhea, but it's not necessary that you will get diarrhea. You know, sometimes your body's natural immunity and your body's, you know, all the good bacteria in your gut will take care of all the bad bacteria from the nali ka pani on the chaat ka thela or the momo ka thela. But it's not necessary that you will definitely get diarrhea if you have thele ka momo, but some people can get it. So the same way, just because you have PCOS doesn't necessarily mean you will have problems with your fertility. Had seen me at AICOG. Oh, thank you so much. Thank you. AICOG is a conference called the All India Conference of Obstetrics and Gynecology. It was held earlier this year in January, the end of January, and I was there. So Reshmi Biswas was also there. So hi Reshmi, I hope I got to see you too. If you guys see me anywhere, guys, please come and say hi. It's always nice to meet other people who are passionate about women's health and reproductive health and health of people of all genders. Thank you. Thank you so much. Hi Anurag. Hi. Hi Shivi. Are foods with low glycemic index good for people with PCOS? Please do a video on PCOS. A PCOS video is in the making. It's just it takes a lot of time to put a video on such a big topic together, because the journey is different for everyone, and I don't want to make it generalized for anybody, so this is going to take a while. I'm sorry. You just have to wait for it now. Foods with low glycemic index. So there's a problem with PCOS where a lot of people who so foods with high glycemic index make your insulin shoot up. This is very complicated, so I don't want to get into this because I know it's going to scare people off, and that's not my aim. But okay, I'm going to ask Sangamitra if she can do a video or a post with me on this, and we're going to discuss glycemic index and food for PCOS. Sorry, Shrishti, pankha on kar do please, bahut garmi hai. Okay, guys, I'm sorry, I'm not taking any more PCOS questions. It's boring. Premenstrual syndrome. PMS is, अरे नहीं यार, PCOS नहीं, हो गया. Premenstrual syndrome is a lot of people before having their period, they have lots of issues like irritability, they have very tender breasts, they get mood swings, they get intense food cravings. Ask me about it. So it is a very well recognized medical condition that PMS is a thing. Some people have very serious mood effects in their PMS part. So if that's the case for you, this can even be something called premenstrual dysmorphic syndrome, I think. It's PMDD for short. I'm blanking out on the full form. But yeah, if that's the case, then you should speak to your doctor. You can seek therapy. You can even get be put on antidepressants for it, because it can be really intense for some people. Hi, PCO. Bye, Manas. Hi, doggy. Someone saying hi to you. Do you want to say hi back? Hello. Hello, Scratchy baby. How do I make my husband more sensitive to moods and PMS? Oh man, I'm sorry. This is such an intense question. This is a conversation you will have to have. I'm really sorry. I'm not able to give decent advice on this. It's I'm not sure I'm the right person to ask this. I'm really sorry. Recommend few sources for trans non-binary intersex inclusive healthcare. I'll have to have a think about that, but that's a brilliant question. Thank you so much for sending that question, and I'm going to see if I can make a list of resources. I know there is a list of doctors online that is good for people who are non-binary. Coffee through. Is good for people who are non-binary and good for people who are trans or intersex. Sorry. So I think it's a Google sheet. I'm not sure, but I'm going to see if I can find it somewhere, and I'll see if I can link it. Thank you for that brilliant question. I will keep it in mind, and I will see if I can do a post on this. Is it safe to have sex on non-fertile days? By safe sex, do you mean sex that doesn't make you pregnant, or do you mean sex that doesn't give you STIs? So safe sex usually means sex that doesn't give you an infection, so sexually transmitted infections. So कोको मैं लाइव करूँ कि नहीं? Hello, sir, please excuse me. Thank you. So, yeah, you can have sex on non-fertile days if you're using a condom, if you worry about safe sex. If you have one partner and you both are tested and you both are clean, then it's fine. Yeah, this fellow won't move now. He sat on my... He keeps coming in my life. And he keeps sitting in front of the camera. Jao. Jao. Arey, utro. Okay. Relaxing hormone. I don't know what this is. Thank you so much, Venba, Amma. Is there any relation with estrogen dominance, PCOS, and family history of breast cancer? Any studies on this? There's a lot of good data on hormonal dominance with PCOS. So PCOS is usually a hyper estrogenic condition, which means that there's more estrogen in this condition in your body than there normally is. Any studies on this? I'm going to have to take a look. If you're talking about a relationship with PCOS and family history of breast cancer, this is a very strict question. Sorry, this is a very specific question. So if you could DM me this and I can take a look and get back to you on this. Okay, let's see what more questions do we have. Do you think PPD is still a stigma in our country? Everything is a stigma in our country. You know, that's the problem. So many people come and send me random shit on my DMs कि अरे ऐसे कैसे बोल रही हो, अरे सेक्स के बारे में कैसे बोल लिया, अरे डॉक्टर होगी अपने खेत में. So yeah, everything's a stigma in our country. Don't worry, man. Chill. Go find the right people to approach. Find the right doctors and have a chat with them. See how they can help you. Don't worry about the stigma. Fuck the stigma. My endo lining is thinned after severe curettage. Sorry, no personal medical questions. If periods are irregular, how to go with pregnancy plans? Speak to your doctor. Thank you, Vandita. I love inclusivity. We cater to everyone. So, what did I just say bad things about momos? Dude, no, I love momos. My Facebook bio says momosexual. I really freaking love momos. I don't know what I said about momos. Did I say something about momos, Rishti? Okay. What kind of food will boost our sexual life? What kind of question is this? Thank you, Karishma. Thank you, Prashant. Hi, everybody who's saying hi. Thank you. Thank you. How to calculate my exact fertile window if my period cycle varies from 28 to 34 days? I am not answering this question because I don't answer personal medical questions, but I will give you a general guideline. The way to calculate your fertile days is pen ka. So for example, अब खाली पेज नहीं मिलेगा. हाँ, ये रहा. For example, if you have a cycle of 34 days, okay? 34. इस पेन से कुछ भी नहीं दिख रहा है. Yes. So for example, if your cycle lasts 34 days, then the way to calculate is that from the day of your first period, subtract 14 days. So 34 minus 14, this would mean 20. Math सही है ना? 34 minus 14, 20 होता है ना? अच्छा. So 30, however long your period is, subtract 14 from it. हाँ, ठीक है. So this is your day of ovulation. So 14 days from this ago is when you would ovulate. This means the day you lay your egg, essentially. You are fertile for up to 5 days before this. So for this person, the fertility window would be between day 15 and day 20. You want to be even more careful, I would take it up to day 13 to day 20. So you have 1 week of relentless banging if you want to have a child. I mean, don't make it so relentless that you get a UTI or something, okay? Like, chill. Like, I mean, be careful. Okay, how to calculate my exact... Good evening. Hi, everyone. How to make my sensitive... Sorry. मैं PCOS की बात ही नहीं करूँगी. हो गया PCOS. As a psychologist, may I do something about women's health and how? Guys, this is a brilliant question by Soumya Sen Gupta 178. Please send your comments. This will be wonderful. It will be very helpful if we can get more people to take women's and vulva owning people's health taken more seriously. So send in your comments here. This will be great. For my cramps, every time I have to take injection. Is there any side effect? Injection क्यों लेने की ज़रूरत है? So if your periods are so painful that you're going to have to go to the doctor, then I think it's best to get it investigated, because very severe pain in your periods usually indicates an underlying disorder. It could even be something as serious as endometriosis. Now, endometriosis is a topic for another video because this is quite long. But basically what happens is that this is your uterus. It has the lining on the inside called the endometrium. This should only grow inside your uterus. This should not be growing inside the rest of your abdomen. If it's growing in the rest of your abdomen, This is a medical condition called endometriosis, and this causes very painful periods, like fuck all periods. Like you kind of start dying. It's very, very painful. So yeah, if you're having seriously painful periods, I would strongly consider speaking to your doctor and seeking some medical help. Sorry. It's good to get investigated. This is indeed my cue to make a PCOS video. बाप रे बाप बहुत लंबा वीडियो है. Sorry, ये नहीं हो पाएगा. Your dogs are too cute. Thank you. And my dogs are also saying thanks. How do you differentiate between white discharge and a fungal infection? So normal white discharge looks like snot, like the thing that leaks out of your nose. It can be clear, it can be slightly whitish in discharge. If it's a fungal infection, it looks exactly like dahi. It looks like dahi coming out of the vagina. It looks like dahi on your panties. This is what a fungal infection looks like, and it's very itchy. It also can burn. It can be very difficult to have sex if you have a fungal infection too. No pregnancy positive. ना मैं नहीं बताऊंगी. Sorry. Personal medical advice नहीं दूंगी यार. Doggy view, right? Thank you so much, guys. Give some attention to Coco, please. Coco's left my room. I think he's gone following my brother. Which kind of food will boost our sex life? नहीं बताऊंगी मैं. ये कैसा सवाल होता है? Thank you so much. Hi Tanya Didi. What food makes me less ugly? Oh, thank you Wordswali. Thank you Saurabh. Hi. Trying second baby. Tell me the remedies. अरे भाई ऐसे कैसे? Can you speak about Kegel exercises? Brilliant question. Thank you. KLDSZKP. That's quite a mouthful. Thank you so much for that brilliant question. So Kegel exercises are exercises that strengthen your pelvic floor. Now what is your pelvic floor? So यार भाभी पड़ी है कोई? ओ पूरण सिंह दो. Right, so this is my teddy bear. His name is Mr. Puran Singh. Don't ask me why. But this is your pelvis. Okay, this is the area where our vulva, vagina, uterus or penis, testicles is, and it usually has it's like a basket, you know, this area, this like the part that continues into your bum and stuff. Your pelvic floor is what brings stability. So if you have a weak pelvic floor, you can have all the organs that are supposed to be inside can kind of fall outside. The vagina is like a window, right? It's basically just an opening there. So if you have stuff that's held inside and it's not held inside properly, it can fall out. It does happen. This is called a prolapse. So to make sure you have a strong pelvic floor, you can do some exercises that can make sure all the organs that are inside stay inside. What you're supposed to do in Kegel exercises is that, okay, when you go to pee, if you were suddenly supposed to hold your pee, like, you know, peeing, and suddenly you have to stop midstream, this is called a Kegel. So if you can keep practicing this again and again, holding your pee, like without actually peeing, this is called Kegels, and they work on strengthening your pelvic floor. It's a really good exercise, especially for vulva owning people, because we generally do have weaker pelvic floors. Hello. Thank you so much. Thank you. More IG lives. Okay, definitely I'll do them on the weekends. Can I talk in Hindi? I have a lot of international following as well, so I want to keep it as inclusive as possible. So I try to stick to English also, because there's so many people in India who are watching me from. I have a lot of followers from the south, so I don't want to be, you know, Hindi only, because that's not cool, you know. India is diverse, we have so many languages. I want to stick to the universal language so everybody can be a part of this and get access to information. Hi Savni. Savni is one of my good friends from Oxford, and she's a brilliant embryologist, so please drop a happy World Embryologist Day to Savni. World Embryologist Day was yesterday and we studied embryology together. Particular time span as in years for which a person can safely take OCPs without having any adverse effects. If see, this is very specific to your medical condition. Sometimes people can be put on OCPs for a long time. Again, speak to your doctor about this. I would not want to give medical advice that is specific to a case. नहीं, मैं PCOS नहीं बताऊंगी. Can intake of coffee in periods harm the cycle? No, that's bullshit. Don't listen to that crap. Coffee piyo aaram se. I mean, of course, don't overdose on coffee. Don't be like coffee all day long. But you know, it's fine. Why discharge and fungal infection? I've already answered that. I will save this video on IGTV's. PCOS curable, answered that. Small uterus to hold pregnancy. If you have a small uterus that is having problems holding a pregnancy, your doctor will give you something called a McDonald's stitch. But this is again very specific medical advice. Save in IGTV, yes. Hormonal injection for fertility treatment, good for health. You can't get fertility treatment without hormonal injections. That's not going to work. You need these. These are medications. Thank you, Savni. Where do I come to consult you? I have a interesting development happening about this that I will release soon. Once we hit 10K, I'm going to release this development. So I'll tell you where you can consult me. Okay guys, I'm tired of talking now. मेरा मुंह सूख गया है. So yes, it's okay to do yoga during periods. All the questions that have already come in, I'm going to answer them. And उसके बाद नमस्कार, शुभ रात्रि, शब्बा खैर. आ गई है मुझे नींद. Sex after fertile window could lead to early miscarriage. No. So sex in your fertile window means sex when you can conceive. So this is the time when your eggs are most likely to receive the sperm. Once you've already had a pregnancy, miscarriage has nothing to do with when you have your sex. Miscarriage has everything to do with the embryo and your uterus. So no, nothing to do with sex. If you try and listen, natural remedies don't work. Okay, the only natural remedy that works is you start having eat healthier food, start getting exercise, focus on lowering the amount of fat you carry. This is the only natural remedy that works. Everything else, bullshit. What's the plan with life? Kash mujhe pata hota. I wish I could answer this question. Thank you. Pilonidal cyst, a serious issue. Will it affect pregnancy? Pilonidal cysts are usually operated. So a pilonidal cyst is basically when pilo means hair, nidal means nest. So when your hair is ingrown and it's so ingrown that it causes an infection. So it causes like a ball full of pus. It's actually really painful. So I wonder why you haven't been operated for it yet. Maybe your doctor is just giving you medication to, if it's not that intensely painful. And if it's a small cyst, it can be controlled. So it shouldn't affect your pregnancy unless it's huge. Drug levoflox. Sorry, no personal medical queries. Breast cancer awareness. Great point. जाओ सो जाओ जाका. ये क्या होता है? जाका क्या होता है? अच्छा जी, बेहतरीन. Thank you. Fungal infection is not curable on its own. You will need antifungal medication. Bye Anand. Good night. Any treatments for chemical pregnancy? No specific medical advice. Why do we bloat during periods? Thank you so much everybody for joining in. Good night. I'm going to save this and okay. I will get back to you Deepa on that very very soon. Okay, bye everyone. Thanks for joining in. Good night. And Amitabh Bachchan sir, what does he say? Shubh Ratri, Shabba Khair. और कुछ भी बोलते हैं, स्टार्टिंग में कुछ बोलते हैं. समय आ गया है आप लोगों से विदा लेने का. गुड नाइट, शुभ रात्रि, शब्बा खैर, बाय.